Hi, my name is Devin Drummond, and I'm a clinical pharmacist at Norton Health Corporation, and I have the pleasure of serving on our diabetes team. What's my role at Norton Health Corporation? Well, outside of the expected duties of dispensing medications and preparing them for delivery, pharmacists work closely with other providers to ensure that patients receive an appropriate, safe, and effective medication therapy to treat their various health conditions, as well as provide a thorough education to each patient on their individualized therapies. How has my work contributed to health promotion and prevention of diabetes? My job as a pharmacist usually begins after a patient receives a diagnosis or is at higher risk for developing a disease or a health condition. So my job is more reactive than it is proactive when it comes to diabetes care. The more vocal I can be now about diabetes and getting information out there to our community, the more patients I can help prevent from developing the disease and falling victim to its damaging effects. Why is it important to create awareness for diabetes? Diabetes is unfortunately a disease that has many consequences, with almost all major organ systems and organs affected by its progression. Common conditions that we see affected or caused by diabetes include high blood pressure, kidney disease, increased rates of infections, higher cholesterol, depression, nerve pain, changes in vision, stroke, and even a heart attack. As a professional, why is it important to prevent diabetes? As previously mentioned, there are multiple health conditions that diabetes affects, and often the damage of the diabetes is irreversible. This damage can be costly, time-consuming, and even life-threatening. Luckily for most patients, diabetes is a preventable disease. If patients take the time to have regular follow-up with their providers and learn about their individual risk for developing the disease, they can help save themselves from the effects of diabetes. Can you explain why it's important to treat diabetes? If patients are ultimately diagnosed with diabetes, there is a silver lining. Diabetes is a manageable disease, and with medication, following healthy habits, and the recommended care, patients can prevent the progression of their disease and the damage that comes with that progression. It may seem daunting to be diagnosed with diabetes, but patients should understand that there is a whole team of professionals ready and trained to help them. Patients should be more vocal about the difficulties that they're having and be more open about that with their team so that they can better gain control over their diabetes and prevent the progression of their disease. So what are some risk factors that you can based on your knowledge as a professional, please identify risk factors that can increase one's chance of developing diabetes. Patients should take time to educate themselves on the diabetes risk factors and learn what may be increasing their risk for development. Risk factors that people cannot change include their family history, age, their ethnicity, and certain health conditions. Fortunately, there are more risk factors that patients do control, and these include diet, their physical activity, weight, stress management, not smoking, and their sleep.